Hi, how you doing this evening?
Good.
Got
I'm
it.
good.
So I see you're working in the ER. So what is your role?
I am a physician assistant. I have worked in the emergency room since 2011.
That's nice.
Mhm.
So what was the reason that you prompted you to become a physician assistant?
So I always grew up with multiple family members in healthcare, mostly nursing, and have always taken to science more so than the arts or language or things like that. I just always kind of gravitated towards math and science. And when I got to college and you had to kind of narrow down where you thought you wanted to end up, it always kind of went back to medicine, like my mom, who was a nurse, sister's a nurse. Now she's a nurse practitioner. But the college that I was at had a very, very good pre med program. So I started the pre med program with the intent that I was going to go to medical school. And while I was in college, I found out what the role of a physician assistant was and decided that I wanted to do an internship. So I did an internship up in Bethlehem and fell in love with it. I liked the fact that you could change specialty, that you were well rounded, that you were essentially doing a lot of the same things as a physician, but with less responsibility, less demand, less years in school and training. So that appealed to me.
That's nice. Yeah. What's the thing that you like about being with people and in healthcare?
I love the relationships that are fostered when you work alongside someone in a very chaotic environment. I truly think anyone that works in healthcare and medicine doesn't is going to agree with the fact that you won't understand what it's like to work in healthcare unless you work in healthcare. So thankfully for me, I have a spouse who works in healthcare so he can relate, he gets it, but for the most part when you're in it with someone else, especially in the emergency room when it is often chaotic, you forge relationships with people, you have to depend on people, you look out for each other, you support each other in a way that I'm sure other jobs have, but it just, for me, it feels like a very safe community. I also selfishly like the confidence that I get from knowing that I'm good at my job and that I've kind of found my place in the world. So that's always kind of rewarding.
Yeah.
Yeah, I don't know if that makes sense.
And it does. What's the most challenging or the challenging aspects of being in the emergency room?
Ooh, there's a lot of challenging aspects of working in the emergency room. I think the biggest one is probably that for the most part, you're seeing people on a very bad day. You're seeing people in pain. You're seeing people there with sick loved ones, possibly very sick loved ones, or people that are passing away, or your kid is sick, or your kid is hurt. So people aren't at their best right off the get go. So you have to go in and establish rapport or gain someone's trust in a very short period of time and also take care of them and figure out what's wrong with them. And there's all of these different factors at play in a very sometimes, again, not to be redundant, but chaotic environment. So that's difficult, is that sometimes you're seeing the worst of people. And then there's other times where you can't make people better or you don't figure out what's wrong with them. And that obviously is frustrating for the patient and then you can run into some confrontation there, but it's also frustrating as a practitioner that you got into this because you want to help people and there's a lot of people that you're not going to help or that you can't help or you might not figure out how to help and that can be frustrating. And then specifically for a mid-level practitioner, it can be hard working with different kinds of physicians until you get to know each particular one's style. It can be like starting a new job every single time you work with a new physician. So that's challenging in and of itself and not panicking, learning how to not panic even when you're panicking. There's that too.
All right. So, do you remember any occasion where love and compassion played a huge role in your practice and made a difference?
Yeah. Yes, truthfully, and a lot of people talk about it. Most of the people you see throughout your shift, you're never going to remember again. But every once in a while, you'll have someone once a year, every 5 years, however often it is, that just stays with you for whatever reason, the way they looked when they got bad news or the way they looked when you helped their child. There's certain things that just, and I think everybody has this to their own in their own sense of that, whatever that is, that they remember certain things for certain reasons. So, yeah, I think mostly interactions with children and elderly. The middle group, for whatever reason, you don't connect with as much. But every once in a while, I'll get a really grateful, appreciative patient or someone that you truly fix and make better. And you can actually see in real time things change. They start smiling when they were in a lot of pain before you figure out what's wrong with them, they feel validated. So there are aspects that are few and far between that you actually help people and you feel that and it's a very incredible feeling and it's almost like you come back each shift wanting that, wanting to feel that, wanting to help people. It's why you went into it. And I think everyone's surprised when they start working in medicine that you don't see that more, that it is so rare. So when it happens, I think you remember it. You're more, inclined to remember those special little moments. I've had a couple moments with children that just stay with you. They're really nice.
So, and do you think I mean, as a practitioners, is there adequate compassion
Mm,
that we are able to show towards the
mm,
patients, especially in the emergency room setting? How possible is that?
mm. I
Or
think,
and
yeah.
is there anything you think could be done?
I think it depends on the day, honestly. There are days where I see coworkers or nurses display a great amount of compassion and still to this day impresses me at the end of a long shift that people have that in them day in and day out. But I would say that overall, since COVID, I think there is very high level of burnout and very decreasing levels of compassion across the board, but it's still there. It's just harder because we're busier and offices are backed up and hospitals have closed and the demands from administration grow, whereas our resources decrease. And I think that that puts a lot of false sense of responsibility on the individual workers, and that just burns them out over time. So I would say post COVID, there's definitely more burnout, less compassion, but it's still there. It's still there.
Can you think of anything, any one thing that would make a huge difference to improve our level of compassion in healthcare?
I think that employees just wanna be heard and they wanna be appreciated, and I think that's what it really comes down to. I think when administration comes through with starbursts or someone sends pizza or something, I think it feels inflated and it feels like they're going through the motions. When you as a person or a healthcare practitioner feel seen and feel validated and appreciated for all your hard work, I think people are much more inclined to keep doing that rather than walking away. And I think that everyone's burned out, so the showing of appreciation from the higher ups and stuff, I just don't think is really happening as much as they think it is. I don't know if that sounds right. It probably sounds ungrateful, but I just think that when you show people that you work with or that work for you that you appreciate them, I think they're more inclined to keep doing it well, if that
It's
makes sense.
nice. I think
Yeah.
I really concur with you in
Mhm.
terms of appreciation, validation. That makes
Mhm.
a huge
Mhm.
difference to whoever.
Mhm.
Just right when you're
Right?
doing the right thing, stopping and just, yeah,
Yeah,
saying
I
that.
it can be as simple as, like, at the end of someone's shift saying, like, "You did a really, really great job today. Thanks for having my back," or, "Hey, you killed it with X, Y, or Z," or whatever it is. I think sometimes that's just, like, the tiny little push that someone needs to keep going. You might not need to quit or whatever it is. And whenever I've been incredibly burnt out, that's always helped me to get some sort of because we don't get it enough. Nobody tells us that we do well. They just tell us all the things we need to do differently or that we're doing wrong, where we can improve. So to hear that you're doing something right, I think is the inertia to keep it.
Okay, thank you
Yeah.
to hear all this and thank you for
Yeah.
taking time.
You're welcome, of
And
course. I
thank
wasn't
you.
rambling.
You do a great job, Jen.
Thank you.